Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. Today on HITshow, WellSpan doubles down with General Catalyst and regulators take aim at AI in healthcare. After the break, Innovaccer makes another bold acquisition. New polling shows parents are skipping childhood vaccines, and Amazon broadens its telehealth reach. Plus, we'll end on a bright spot supporting family caregivers. Let's get started. We begin with a health system partnership designed to reshape the very DNA of care delivery. Teresa Bond has the story.
WellSpan Health is taking its collaboration with General Catalyst Health Assurance Transformation Company, or HITco, to a new level. The relationship began in 2023 when WellSpan became one of the first systems to align with HITco's vision of redesigning care through both venture capital and operational expertise. This next phase goes beyond pilots and digital tools. HITco and WellSpan are targeting core system transformation, integrating startup-driven innovation into workflows, experimenting with new care delivery models, and rethinking financial structures to move faster toward value-based care. Leaders say the partnership is not just about bolting on technology, but about building a living laboratory where new solutions can be tested across a regional health system in real time.
So, Teresa, what does that mean for other hospitals who are also following this story?
It's a proof point. If WellSpan and HITco can show measurable gains in cost, quality, and patient satisfaction, it may set a precedent for other health systems to partner with capital-backed transformation firms rather than relying solely on internal innovation teams.
Thank you, Teresa. Meanwhile, two big developments in healthcare AI are converging. Anika Shah has the details.
The Consumer Technology Association just released the industry's first predictive health AI standard. It's designed to give developers a common framework for building, validating, and benchmarking algorithms that forecast outcomes, such as which patients are at risk of readmission or complications. Advocates say the standard could help hospitals and payers distinguish between black box tools and those that meet clear testable criteria. At nearly the same time, the FDA announced it will convene an advisory committee to examine oversight of AI-powered mental health devices. The move reflects rising concern over the use of chatbots and conversational AI in patient-facing roles, especially as more people experiment with these tools outside of clinical supervision.
That's a lot of movement in one day, Anika. What's the bigger picture?
It signals the field is maturing quickly. On one side, industry leaders are creating technical guardrails for innovation. On the other, regulators are stepping in to ensure that adoption doesn't outpace safety. For hospitals, the combination of standards plus regulatory guidance could bring clarity in deciding which AI tools to adopt and which to avoid until the rules are clearer.
Thanks, Anika. Still ahead, Innovaccer makes its fourth acquisition in 2 years. New polling highlights troubling gaps in childhood vaccinations, and Amazon adds a new service to its telehealth platform. That's coming up after the break. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
Welcome back to HITshow. We turn now to a major move in the digital health space. Logan Stokes reports on what this acquisition means, not just for Innovaccer, but for health systems looking for scalable specialty care.
Innovaccer has acquired Story Health, a company founded by Tom Stannis, formerly of Verily and Google. The deal expands Innovaccer's reach into specialty care, particularly around cardiometabolic disease, adding a model that combines AI agents with health coaches to support patients outside the traditional clinic setting. Some compelling metrics from Story Health's work: in participating health systems, Story Health has achieved up to 60% reduction in hospitalizations, along with readmissions rates well below the national average. This suggests the model doesn't just help patients, it eases system burden. The acquisition is Innovaccer's fourth in 2 years, building on earlier purchases like Cured and Pharmacy Quality Solutions. Innovaccer is clearly executing a strategy of assembling tools and talent in order to drive what its CEO, Abhinav Shashank, calls agentic specialty care.
Logan, do we know how Innovaccer plans to integrate Story Health's capabilities into its existing portfolio?
From what Innovaccer's public statements indicate, the company will embed Story Health's care model into its healthcare intelligence cloud. That means combining Story Health's coaching tools with Innovaccer's existing AI, data analytics, remote monitoring, and platform services. The goal appears to be an end-to-end specialty service offering from diagnosis to ongoing care, delivered in hybrid settings.
Thank you, Logan. Let's turn to childhood vaccinations. Jade RomeroA has the latest, and the numbers may surprise you.
They really might, Steve. A new Washington Post KFF poll shows about 1 in 6 parents in the U.S. say they've delayed or skipped routine vaccines for their kids, not just COVID or flu shots, but staples like measles and polio. The most common reasons? Worries about side effects and a deepening lack of trust in federal health agencies.
That's really unusual, Jade, especially for vaccines that were once considered automatic.
Exactly. Public health experts are worried because even small drops in vaccination rates can lead to outbreaks of diseases we thought were long under control. And when you add in misinformation online, plus skepticism toward government guidance, it creates a tough environment for providers trying to keep communities safe.
So the concern is less about one child missing a shot, and it's more about herd immunity at large.
That's right. A few skipped vaccines can spread risk across whole classrooms or communities. The message from health leaders is clear. Restoring vaccine confidence is just as critical as ensuring access.
Thanks, Jade. Finally, Amazon is making another play in healthcare. Nate Collier has more.
Amazon Clinic will now offer virtual nutrition counseling by adding registered dietitians through its partnership with Faye. The move broadens Amazon's direct-to-consumer telehealth services beyond urgent care and primary care, positioning it as a one-stop shop for everyday health needs. It's the latest step in a steady expansion that began when Amazon acquired One Medical in 2022 and rolled out Amazon Clinic nationally in 2023. Since then, Amazon has steadily layered in new services, from urgent care visits to prescription delivery, and now preventive health. By moving into dietitian counseling, Amazon is signaling that it's not just competing for transactional visits, it's pushing into longer-term, lifestyle-oriented care, an area where hospitals and health systems have traditionally worked to build loyalty.
So this could complement traditional care, but it also means Amazon is creeping into territory once owned by providers.
Exactly. For some patients, Amazon may become the front door for everyday health management, which puts pressure on hospitals and clinics to prove their own value in convenience, continuity, and trust.
Thanks, Nate. And we close with a bright spot. Jalen Cross has the story.
Rush University Medical Center, with funding support from the John A. Hartford Foundation, is expanding its award-winning Caring for Caregivers model to 100 new healthcare sites. The initiative recognizes that family caregivers are an essential, but often overlooked, part of the care team. As part of this expansion, Rush will also train 150 public health professionals and prepare 20 public health departments to formally integrate caregiver support into their work. The program aims to create a stronger, age-friendly ecosystem that acknowledges caregivers not as visitors at the bedside, but as partners in delivering care.
That's the kind of story that makes me smile. Because when caregivers are cared for, patients get more love, more attention, and a little less stress. Sometimes the best medicine is simply not being alone in the journey.
Absolutely, Steve.
Thanks, Jalen. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.